Good morning, everyone. Happy Rotary Thursday. It is so great to see everybody here today. We have a full house on the in-person side. It looks like we have a good bit of folks on the Zoom side, so that is fantastic. Um, we're going to go ahead and get started with the invocation, and Pat is going to lead us in the invocation. Can everybody hear me on the Zoom side? Thumbs up if you can. Perfect. Thank you. Pat?
Good morning. Please bow your heads, please. Heavenly Father, thank you for the blessings of this day, for the opportunity to fellowship together with friends and fellow Rotarians. Guide us to help those who are in need or hurting. May we help them find a better life through our Rotary service to mankind. Be with our fellow Rotarians who are unable to join us today. Watch over them and protect them until we are able to meet in person again. We thank you for the sacrifices of the nurses, the doctors, and the scientists. We ask you to protect them as they work so hard to keep everyone safe during this pandemic. We ask you be with those in harm's way, with the military, the police officers, the firefighters, the first responders, whoever and wherever they may be. Protect and guide them as they go about their daily lives. We give thanks to our teachers, our educators, as they prepare our children to be the future leaders of our country. And now we ask that you bless this food and its preparer. Amen. Please face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Okay, it is a great day in Rotary when you have so many guests, and we have some esteemed Rotarian guests that I'll introduce in just a second. And we have some other guests in the room, and I think on the Zoom side. So let's start on the Zoom side. Do we have any guests aside from our guest speaker today on the Zoom side?
Jonathan?
Yes. Hey, thanks for having me.
Okay, we have Jonathan with us. I think he's one of he's Kim's guests. Is that right, Kim? Okay, Jonathan, nice to have you with us here this morning. Hope you'll join us again. I see Rontario's on there. Rontario, nice to see you again. I think
Good
you
morning.
might morning. I think maybe you have some paperwork coming at some point. So it's nice to have you as well, Rontario. This is probably your third or fourth time joining us on Rotary. Okay.
Yes. Uh-huh.
Kimberly, did you want to say something? She's good. Okay, and then on the in-person side, we have some esteemed Rotarians, and of course we have Emily's son over here. Dennis, would you mind passing Emily, Alex, the microphone so he can kind of introduce himself?
Hi, I'm Alex McIntosh. I'm Emily's son. I'm a junior at Bob Jones. I came here because I'm interested in learning genetics in college, and I wanted to hear what Dr. Lim has to say at this meeting. So.
Thank you. Okay, he's not here for me. He's here for our esteemed speaker this morning. So, okay.
So no, I was just going to say he is actually one of the new officers of the new Interact Club at Bob Jones that we're trying to get started again, along with Pat's grandson Camden and Leah Lessman, Alice Lessman's daughter. They're trying to get it going back again. And he recently got his Eagle Scout too. So.
Okay, thank you, Alex. Thank you, Emily. And we're excited about the Interact Club starting, so you have our full support. I think Carrie, who might be on the Zoom side, is helping with that. Okay, so we have Bill Petty, who's our previous district governor and now does all things Rotary. Lee Wyman, our current district governor, with us this morning. And we have Mary Grace Evans, a future district governor. And we also have Pat Cross, a past district governor. So we have a lot of leadership, a lot of Rotary leadership at that table. I'd like to ask Bill to come up. He has something very special he'd like to present to one of our Rotarians. This has been a year in the making thanks to COVID.
Peter is right that it's been a year in the making. About 1 year ago, okay, I actually told everybody in this club about this. And I think I'm preaching to the choir when I tell you that Pat Cross is a fantastic Rotarian. What I'm giving her today is called the Service Above Self Award, okay? And basically it says on here, the Board of Directors of Rotary International bestows this award on Patricia Cross, who through devotion and exemplary efforts exemplifies Rotary's motto of service above self. I will tell you right now that only 1 out of over 10,000 Rotarians receive this every year. Okay. So I wanted to do this in person. I know I announced this. I announced it at my district conference, but I want to give that to Pat. So Pat, come on up here so you can receive this. Basically, thank you for doing that. Now I want to turn this over. I didn't know this. I came up here with
Hey, Bill, we can't hear you.
I also want to turn this over to Lee Wyman, our current district governor, who I didn't know had some awards for the club itself that he wants to present this morning. So Lee.
You move the stand. You don't think I need to stand on it?
I saw Bill trying.
Like Bill said, I have some awards for the club. Now, these awards are for your efforts during Bill's year, during 2019 and 20, and they are called Banner Awards. And so, first of all, I want to present a certificate for your contributions to Polio Plus. There was an effort during Bill's year that the Rotary Foundation wanted all clubs in the world to contribute $1,500 to the eradication of polio. This club achieved that. Secondly, this club contributed to the Rotary Foundation through its annual fund. Hang on, I'll tell you exactly. $291.56 per capita during 2019 and 20. And that was ranked number 2 in this district. And so for that, you receive a banner. And that is only one of 1,500 banners that were presented out of 35,000 clubs. And so that's quite an achievement. That's less than 3%. So Peter and your predecessor, Larry Smith. Okay, well, congratulations, Larry, and your foundation chair. Thank you for all that you do for Rotary, for the Rotary Foundation. And here's a letter explaining some of the details of those awards. Thank you.
I do need the box, so. Larry, you saw some of your kudos there. Great job during your year as president, and we have these awards here. Thank you for your leadership, Larry. Okay, so we have some good news. Since we're talking about good news, let's keep it rolling and let's move right into brags. And I'm going to call 2 people out that I think are with us on the Zoom, and I'm going to start with Mark Highsmith. Hey, Mark, you had a big honor and award recently. Do you mind sharing that with us?
Yes, good morning, Mark Highsmith. Yeah, I am also a member of Alpha Phi Alpha Fraternity Incorporated, and we do an annual Brother of the Year competition. We start at the local level and we go all the way up to the national level. And this past weekend, I was awarded I found out that I am the Alpha Brother of the Year for the state of Alabama. So it was a pretty tough competition, but I'm glad to be a part of that. Thank you.
And I think now you go into the southeastern or
Yeah.
southeastern area.
Yeah. So next month I will compete for the Southern region.
Awesome. So congratulations, Mark. And we have Dr. Davis on as well. I think I saw her on the Zoom, and she had a really high honor very recently. Dr. Davis, do you mind sharing that with us?
Good morning. Well, I was appointed and elected to the Southeastern region, which is 3 different states, Alabama, Tennessee, and Mississippi. And it's you compete against over 106 chapters. And I was elected as the chapter president of the year for the Southeastern region.
That is great news. That is very competitive there. So we have a lot of winners here in Rotary Club of Madison. So congratulations again, Pat. We know Pat's a superstar. So, okay, go ahead. Dr. Davis, do you mind mentioning the organization that you're a part of that you won the high award?
I'm a member of Alpha Kappa Alpha Sorority Incorporated, and it's over 300,000 members.
So that is quite an organization. I think our vice president is a member of that.
Yes, I'm
Yeah.
very proud of that, to be a part of the organization. That our vice president, Carmela Harris, is a member.
Yes, ma'am. Congratulations. I think Pat has a brag, and if somebody takes the mic over to Pat so she doesn't have to, there she goes.
I would like to announce that our granddaughter, Carson Grant, is graduating from Auburn University with a chemical engineering degree. She has accepted a job. She is working for Evonik, which is an international company housed in Germany. And she will be on a 2-year rotation where she will do 9 months training at a site here in the States. And then she will go to Germany for 6 months and then come back to the States for another 6 months. And then I guess settle into whatever she decides to do for the company. But we're really proud of her.
Awesome. Okay, a lot of good news happening today and this week. Any other brags before we move on? I'm going to skip my slides just to give Dr. Lamb enough time. Okay, you just get the mic if you're talking to the mic.
Yeah, Nathaniel was notified yesterday that he received his 2nd scholarship from the engineering College of Engineering down at Mississippi State.
Not the first scholarship, the 2nd scholarship. So great news. Any other brags before we move on? I'll just mention a couple of things and then we'll turn it over to Mark to introduce our guest speaker. Okay, couple of quick things. Let me see what's the most important here. Remember, if you attended RLI once this past Saturday, which was fantastic, it was my first time attending. Great job. I know a lot of Rotarians here are either participating or part of the leadership in it. So thank you. We have our 2nd class this Saturday. So that's just a reminder. I'm going to skip my slides, but I do want to give some kudos to some folks celebrating some special days. I think I saw Emery on the Zoom. Emery is having a birthday on the 18th. So happy birthday, Emery. David Perkins is having a birthday on the 21st on April. So happy birthday, David. And we do have one Rotarian anniversary. Mason Orzo has been with us for a year now. So I think he was our first virtual induction, Mason was, but I think he got to join us once or twice as a guest. So he hasn't seen it fully virtual the entire time, but Mason has now been with us a full year, and he was our first virtual inductee. So congratulations, Mason. I am going to turn this over now to Mark, and Mark, please.
Thanks, Peter. It gives me real pleasure to introduce Dr. Neil Lamb this morning. Dr. Lamb leads the educational outreach team at Hudson Alpha in their endeavor to cultivate a more genomically literate society and to inspire and train tomorrow's biotech workforce. This past year, more than 1.9 million students, educators, practitioners, and members of the general public were impacted by his team's efforts. In 2018, Neil's contributions to the advancement of science education earned him the Faraday Science Communicator Award from the National Science Teachers Association. And more recently, he was appointed by Governor Ivey to serve as the founding chair of Alabama's STEM Council and was instrumental in developing Alabama's roadmap to STEM success. Since last March, Neil has created, by my count, about 64 3 to 13 minute videos on all aspects of COVID. The series is called Beyond the Blog, Shareable Science with Dr. Neil Lamb, and they're the most understandable, down-to-earth explanations I've seen anywhere. And I believe that's a tremendous example of just public service to our community and beyond. Neil and his wife, Cynthia, live in Madison and have 3 children whom he considers to be his most fulfilling genetic achievement. So we really appreciate him giving us some time this morning. I think it'll be fascinating, and I anticipate lots of questions. So, Dr. Lamb.
Good morning. Thank you, Mark. So it's great to see everybody. Thank you, whoever just turned the camera around. Now it's really great to see everybody. Those of you that are joining us on Zoom and that are joining virtually, or well, you're in the room, I'm on Zoom. We're gonna spend just a little bit of time talking about where we stand with COVID and what is happening now with COVID. And so let me move through this. Then I'm going to talk about some key questions I'm often asked. And then my goal is to have time for us to have some questions from the audience as well. So we're going to start with this. So let's look at what our new cases are. How many new cases of COVID-19 are being reported? And this is specifically going to show you in Madison, in the Huntsville metro area. So this is the daily new cases per 100,000 individuals. And you can see, this is the graph all the way back from the beginning of the pandemic. And you can see that spike that we hit in the summer, and then you can see that really horrific spike that we hit through the winter. We're at about 7.4, 7.6 cases per 100,000 individuals. That's around 30 folks, 30 new cases in the Huntsville metro area. That's a nice number. We would like that number to be even lower, but that is a really good place for us to be. That tells us that at least in our community, the rates of infection are, I wouldn't say they're necessarily terribly low, but they are moderately low. We don't have rampant infection moving through the community, certainly not like we did back in November and December and early January. So now let's talk about vaccines. So there are 3 vaccines. Actually, let me do this. Let me take this away for a second. There are 3 vaccines that have been given emergency use authorization here in the United States: the Moderna, the Pfizer, and the Johnson & Johnson. And I bet you got some questions about at least one of those based on some data that's come out this week. But let's do a quick comparison of those 3. So there's a lot of data on this slide. I'm going to talk through it at a really high level, and I'll refer you to some of the videos that Mark mentioned. The Moderna and the Pfizer are a tool called mRNA vaccines. So they use a piece of instruction called mRNA that enters your cell, and it tells your cell to create the spike protein. That's the protein that sits on the outside of the virus. And then that spike protein gets put on the outside of your own cells that have been vaccinated. And that triggers your immune system to say, I haven't seen this before. I need to build an immune response against it. The Johnson & Johnson vaccine is a little bit different. It uses a viral vector. So it uses a virus, a cold virus that's been modified. So it can infect cells, but it can't do anything else. It can't make more copies of itself. And it infects the cell, and it also puts a genetic recipe for the spike protein into your cell, and then you go through the same process of creating spike protein on your immunized cells, and it triggers an immune response. The Pfizer vaccine is authorized for individuals 16 and above. Moderna and Johnson & Johnson are 18 and above. Pfizer is 2 doses, 21 days apart. Moderna is 2 doses, 28 days apart. Johnson & Johnson is 1. All right, then there's a bunch of numbers on here. And essentially, those numbers are showing you the efficacy of the vaccines at preventing serious COVID. So vaccines have been developed to keep individuals from getting so sick with COVID that they have to be hospitalized and put on ventilators. And the Moderna and the Pfizer vaccines have about a 94%, 90 to 95% effectiveness. They are very effective at keeping people from getting really ill. The Johnson & Johnson vaccine is slightly less effective at keeping people from getting any form of COVID. So it's more like 75, 78%, but it is 85% effective at keeping people from getting serious COVID and 100% effective at keeping people, at least in the clinical trials, it was 100% effective at preventing death. So all three of these vaccines do what they were designed to do, which is keep people from getting seriously ill. That doesn't mean that people who are vaccinated might not get COVID. They would be expected to get a milder case, but it keeps them from getting really ill. Okay, now let's talk about the data that came out a couple of days ago. The FDA and the CDC recommended that states put the Johnson & Johnson vaccine, the use of the vaccine on pause while they met to discuss a really rare but very serious side effect. And that's this, this case of certain forms of blood clots forming, in some cases in the brain, in some cases in other parts of the body, and at the same time, having a lack of platelets. And platelets are what actually help your blood to clot. So this might seem kind of counterintuitive. How are you having clots if you don't have platelets and you are running, and so you run the problem of clotting? The biology behind that's a little confusing, but we actually see that in other disorders as well. So it isn't something that we've never seen before. There have been almost 7 million doses of the Johnson & Johnson vaccine given in the United States. And there were 6 cases of this really serious complication that had been identified. And it's possible because this shows up primarily in women under the age of 50, those 6 cases, and it showed up between 6 and 13 days after vaccination. So we might expect to see a handful of other cases show up as well. And the FDA has said we want to put this on pause while we explore exactly what this means so that we can make some recommendations. For example, it might be that we would recommend, if we determine that there's a true biological link, it might be that we would recommend that young women think about Moderna and Pfizer, and older populations look at Johnson & Johnson. I do not want to downplay these 6 cases. These are serious cases, but I want to put them in context that this is 6 out of 7 million. And so this is a rare side effect. And we expect to see rare side effects when you move any drug out of clinical trials where you're looking at tens of thousands of people who are receiving the drug, and then when you roll it out to millions of individuals. One case of this was seen in the Johnson & Johnson clinical trials. So the FDA has been watching for this. It was part of their emergency use authorization with watching for these kinds of things. So this is worth paying attention to. I understand why they've gone on pause to try to understand the biology, but I also want to say this is a rare side effect, and it's important for us to put rare side effects in context. When something gets a lot of press in our brain tends to potentially put that in a different proportion compared to what the actual risk is. And so we just want to be aware of that. Okay, so with that in mind, also in Europe, you're seeing the same sort of thing happen with the AstraZeneca vaccine. That has not been brought to the United States for the FDA for emergency use authorization. You can't get the AstraZeneca vaccine in the US. Interestingly, the AstraZeneca vaccine and the Johnson & Johnson vaccine use a similar kind of platform. So it might be, if it's biologically linked, this set of cases to Johnson & Johnson and AstraZeneca, that it might be a rare complication of the specific way that they are delivering their vaccine. It's one of those things where we're just going to have to gather more information. The Johnson & Johnson vaccine makes up about 5% of the United States vaccine totals to date. So it's a relatively small number. It's an important number, but the bulk of the heavy lifting for vaccination has been the Pfizer and the Moderna vaccines. In Madison County, here is the data. So as of yesterday, 168,000 vaccine doses have been administered in Madison County. And that's out of 3.2 million doses that have been delivered to the entire state of Alabama. And you can see the blue bars, they show you that the number of vaccinations in Madison County every day. So we continue to be on an upward trajectory that is really positive. Now let me show you something that I think that troubles me a little bit. So this is looking at vaccinations in Madison County. And I recognize that there's a lot of words on here. So I just want you to focus on the pictures. Don't worry too much about what the words are. I'll walk you through it. This is in Madison County. The image on the left, the circle graph, is showing you what percent of individuals have received vaccinations in Madison County. The blue bar is individuals that don't tell you anything about their race. So this is broken out by race. The red bar is individuals that self-identify as Caucasian, and the green bar is individuals that self-identify as African American. It's about 14% of the vaccines that have been given to African Americans. If you transition over to the bar graph on the right-hand side, now you're looking at what percent of individuals in Madison County have received the vaccination by race based on the percent of individuals in the county of that race. So for example, you can see that down at the bottom, 26.7% of Caucasians in Madison County have received the vaccine, compared to, I've got to put my glasses on and look at that a little more closely because it's really small on my screen, 18.4% in green of the African American population in Madison County. So right off the bat, you see that there is a difference in the uptake of the vaccine across different ethnic and racial groups. And that's, number one, probably partly an issue of access. Are we able to get vaccine to individuals from these different groups in their communities? Number two, that might be a difference in vaccine hesitancy among these groups, but it also might represent challenges in being able to get the vaccine. Those of you that have been vaccinated, you might have had to go through a whole set of hoops online trying to find vaccine. You might have had to look at multiple different websites. You might have had to make an appointment in a county that is not Madison County that you could drive to, or maybe even to Tennessee. Individuals that are not internet savvy, individuals that have jobs that don't let them take away in the middle of the day to go get a vaccine, individuals that don't have transportation to go get vaccines are going to be challenged by the way the system is currently set up. So we still have some disparity issues, some significant disparity issues. And I want to put this over and above the fact that around the country, individuals of color are at a higher risk of getting COVID-19, of being hospitalized and dying compared to their white counterparts. So this is an issue of equity that we've got to figure out in our country, in our state, and here in our own community, how we address. I am encouraged that the number of vaccinations continue to go up. I'm a big fan of vaccinations. I got my first vaccine 2 weeks ago. Everybody else in my family, including my 17-year-old daughter, is in that vaccination process in between their first and second dose. I recognize that there are risks, that there are questions that each of us have to ask ourselves about the risk. And so let's dig into that a little bit. So these are some of the questions that I am commonly asked. Do vaccines prevent the spread of the virus or just protect against serious illness? I told you that the vaccines were developed specifically to keep people from getting really ill and wind up hospitalized and on ventilators. But scientists all along thought, because of the way vaccines work, that we also would see a reduction in infectiousness, that if you were vaccinated, you would be less likely to get infected if you were exposed and less likely to transmit that to someone else. But the trials didn't test for that. Now that we've got this rolled out into hundreds of millions of individuals around the world, you can actually do real world studies. And we're seeing somewhere in the neighborhood of 80 to 90% effectiveness against protecting individuals from getting infected if they've been exposed and from transmitting it. So not only do the vaccines keep you from getting really ill, they also keep you from getting the infection and passing it on. Now, that's not 100%. So you're going to see people that get reinfected. You're going to see what's called breakthrough infections. And we shouldn't freak out about that. We should expect to see that. But by and large, vaccines are doing their job at reducing overall rates. As a side note, people who have been infected with COVID and recovered also are showing somewhere in the neighborhood of 70 to 85% effectiveness at being protection from being reinfected. Now, that varies because there are some people in the population that were infected in a really mild way, and they built no immune system. So they have almost no immunity. Other people that were really ill have a much stronger immune response. So there's a huge range of what immunity you've got if you've naturally been infected, which is why you're seeing recommendations that individuals, even who've been infected, think about getting a vaccine shot. I think we're going to see in the not too distant future the recommendation that individuals that have had a COVID infection only need to get one shot, not two, because the data we're seeing is that after one shot, that really wide range of immunity really narrows and increases to the level of people who have had 2 doses of the vaccine. We'll see. We've got more data around that. Please don't run out to your doctor and say, Dr. Lamb said that I only have to get one shot because I've already recovered from COVID. The data don't yet support that, but that's what I think it's beginning to trend towards. Are vaccines effective against the variants? So there are 3 key variants that we are watching around the world. And a variant is simply a version of the virus that has gained new genetic mutations that have altered how the virus works. So there are 3 that we're watching. They've got scientific names like B.1.1.7, but I'm going to just tell you the name of where they were first identified, which is what you're probably the most familiar with. The variant that was first identified in the United Kingdom, the variant first identified in South Africa, and the variant that was first identified in Brazil. So we're just going to go with those 3. All of those have acquired new mutations. The variant identified in the United Kingdom is more easily transmissible. It is more infectious. And there's some data, although we're seeing some conflicting information, that it actually causes a more severe form of COVID-19. That is now the version that is almost certainly the dominant version across America. It's not necessarily dominant here in Alabama, although we're seeing numbers in the 20 to 40% range of infections that are of this variant. It certainly is what you're seeing in places like Michigan and the Northeast. It has replaced what we'll call classic SARS-CoV-2, in part because it is so much more infectious. The South African variant seems to be more infectious, and it seems to be able to escape some of the immune response, both from people who've naturally been infected and who have been vaccinated. But there's a buffer built in to your immune response. And it seems that even though that immunity drops with this particular variant, you still have enough immunity remaining that it does its job against protecting you from getting really ill, at least in most people. And the Brazilian variant, we're still gathering data on. So are the vaccines effective against these variants? Yes. I'll note that the AstraZeneca vaccine, which again, not approved here in the United States, but that data suggests it is not effective against the South African variant. That's why South Africa does not use it now in its vaccination scheme. But the Moderna, the Pfizer, and the Johnson & Johnson all show efficacy, although it is slightly reduced for the South African and the Brazilian variant. We're just going to have to keep watching this. That viruses mutate. That is the way they work. And it's a race between getting enough people immune, either from a natural infection or from a vaccine, that you reach herd immunity, where it is difficult for the virus to find someone new to transmit to, somebody that doesn't already have immunity. If you can reach that, or you can begin to reach that, you slow the spread and you reduce the frequency that too many V words this morning. You reduce the frequency that the virus will mutate and gain enough mutations that the vaccines are no longer effective. The beauty about the mRNA vaccines, the Pfizer and Moderna, Moderna is that within about a 6-week window, you can design a new piece of mRNA that will be effective against additional variants. And the FDA has already laid out what those clinical trials would look like if we reached that point. We are not there. Let me be real clear. We are not there. But if we are, there is a plan in place for what that would look like. Next question. How long does protection last? Right now, we know protection lasts for at least 7 months. And I say at least 7 months because that's about the amount of time that the people that were enrolled in the first clinical trials last summer have now had the vaccine in their system. Do I think it's going to end at 7 months? I don't think so. I think we're going to see that move out to 9, 10, maybe even 12 or 15, but we won't know until we reach that point. We also are seeing pretty substantial immunization from people that have been naturally infected at that 7-8 month window. Although, as I told you a couple slides ago, you still see that huge range with some people having a really robust immune response and some people having almost no response. Can vaccines be given to ... So let's just work through this one pretty quickly. Can they be given to children? Right now, only Pfizer is available for 16 and 17-year-olds. None of the others can be given to 16 and 17-year-olds. There are clinical trials in place right now for 12 to 16, 17-year-olds. That's showing pretty promising data. I think that by the time we hit summer, you're going to have those individuals eligible for vaccination. Children, I think you're going to not see any data until we get into the fall about that. And I think that you're going to potentially see some differences among school-age kids and maybe really young kids. So we don't know. I'm not saying that the vaccines aren't effective. We have every reason to think they would be, but we know that young kids are less likely to transmit the virus. Once you get into that, 12 to 18-year-old range, you're now transmitting like an adult. So I think vaccines become really important when you talk about that audience. We're just gonna have to wait and see. Pregnant and nursing women were not included in the clinical trials, but there have been a number of recent studies looking at that, finding that pregnancy, being vaccinated during pregnancy is safe. The antibodies that the woman's immune system create cross the umbilical cord. If she's nursing, they cross into through breast milk, and so they provide some immunity to the infant. I think we're just going to need more data to really cement that answer. Immunosuppressed individuals that have had like a bone marrow transplant or a solid organ transplant. The data suggests that the vaccine is safe for these individuals, but they produce a lower immune response. And that's not surprising because they're on massive doses of drugs to suppress their immune system so they don't reject their transplants. So again, small numbers, I think we're going to have to wait and see. The advice is if you're not actively in the middle of a transplant process, vaccination is not a bad idea because people that have had that are immunosuppressed are at a higher risk if they get infected of having complications. But recognize the vaccine may give you less benefit. Okay, and then my last question that I'm asked, are the vaccines safe? Vaccines are one of the most heavily tested and trialed medicines on the planet. And even though we just went through what was called, and it made me cringe, Operation Warp Speed, what they cut was red tape, not corners. They figured out how to actually run studies in parallel instead of waiting in between. And they were able to ramp up supplies of the vaccine and figure out how to make millions of doses before they actually got FDA emergency use authorization approval. So they were able to condense timeframes, but they still went through the preclinical trials. They went through phase 1, phase 2, phase 3 clinical trials. The side effects that we have seen that are common are the things you've heard about: a really sore arm after injection, headache, body ache, fever, chills, muscle pain. Within about 24 hours of getting vaccinated, that disappears within about 24 hours. Those are the common side effects, often worse in the second dose than in the first dose. Not everybody has those side effects. Then there are the rare side effects that you see when you begin to go from 40,000 people to 5 million people. Those are things like the anaphylaxis shock, that allergic response. You see that at about 2 to 5 cases per million doses of vaccine with the Pfizer and Moderna vaccines. That's why you wait 15 to 30 minutes after you've gotten your first shot at the clinic or at the health center to see if you develop that response. And they've got the EpiPens there and available if you do. A serious side effect, but a rare one. And then this blood clot issue that we've just talked about that may come out in the range of somewhere between 1 in a million, 1 in 500,000 and 1 in a million. We'll have to wait and see. Again, we saw that at a really low level in the clinical trials. And so this is something that they've been watching. Let's talk about long-term side effects, because I can't tell you what happens 2 years from now, 3 years from now, 5 years from now with this vaccine. And anybody that tells you they can is lying to you. But we can look at what happens with other vaccines. And with other vaccines, we don't see serious side effects happening outside of a 2-month window. We rarely see side effects happening outside of the 6 to 14 day window. But when we do, they're all within that first 2 months. That's why the clinical trials ran for more than a 2-month window of following up of patients, and they continue to follow up patients. There's a built-in system where you can submit information about I've had an effect. Hospitals and doctors and healthcare workers are required to submit serious adverse effects that happen to people when they have had a vaccine within the last several weeks. And then the FDA and the CDC follow up on those. So can I promise you there are no long-term side effects? I can't. But can I tell you that we don't see that with other vaccinations? And so we don't have reason to think you would see long-term side effects. I know that there was a miniseries that came out on Amazon Prime last year about a doctor who thought the world was overpopulated and created a fake flu pandemic to give people vaccines that sterilized them. I recognize that, but that is a miniseries. That is not reality, but that does not make my job and your doctor's job any easier. There's lots of misinformation going around. There's lots of people asking real important questions, which they should, but there's huge amounts of misinformation. And so my last slide is that I create, as you heard, a set of videos, Shareable Science Beyond the blog. There are 63 of them. I'm about to film video 64 right after this. Short sections that answer key questions about what's going on with the virus, what's going on with vaccines. I talk about side effects in the most recent one. We talk about issues of long-term and short-term side effects. I'm about to talk about what do we know about natural immunity. So I would encourage you to watch those, to go to trusted sources, ask questions, but just be aware of where you get your information. And Peter and Mark, I apologize because I've run us right up to time, and I know that you guys are really good about getting out. So I haven't given us much time to ask questions, but I'm going to put that in your hands.
Okay. Yes. Thank you, Dr. Lamb. That was fantastic. All great information. Normally we stop at 8, but I'm going to make an exception in this case. If you have a couple minutes after to just run through a couple of questions. So if you need to leave at 8, please feel free to stand and leave. Otherwise, we'll try to end this maybe 8:05. So I apologize.
Neil, this is Ron Klein. My understanding is in the Spanish flu that predominantly affected people in their 20s or young 20s. Polio predominantly affected children. This one is most damaging to older adults. Why is the effect different because of age?
Ron, that's a great question. Yes, you're right. Different viruses hit hardest at different age groups or different susceptibility groups. This one seems to hit hardest in older adults. Number one, because older adults have weaker immune systems. Number two, the way this virus gets into our cells seems to be through our nasal passages, through a specific protein that sits on the outside of our cells. And children seem to have that protein in lower amounts. So it is less likely for them to get infected. Now, that doesn't mean they can't get infected. Their immune systems seem to be stronger, especially what's called their innate immune system, which is their first line of defense that says, there's an invader in the house, rush the system. So for whatever reason, different viruses use different tips and tricks to get in and to set up shop. And so you end up with different populations being more or less seriously affected.
Dr. Lamb, I have two friends that I just heard lately talk about having been infected. They got long haul symptoms. You know, they continued to have symptoms. They got in both cases, it was a 2-shot vaccine. And after the second shot, those symptoms went away. Are you hearing anything like that?
I am. I've been watching a lot about long haul COVID. In fact, 2 videos ago, we focused on long haul COVID, and the data seems to suggest, at least for some of these individuals, that getting their vaccine seems to clear or improve many of the symptoms, not all. The scarring of the lungs from people that had really serious COVID and were in the hospital, that doesn't seem to improve with vaccination. But many of the other symptoms like the brain fog and the exhaustion and the aches and pains do seem to get better. I think we're going to see a science study of that as we get larger and larger amounts of data. But anecdotally, that's exactly what I'm hearing.
Thanks for all the information. Is it your thought that we'll be doing this, getting vaccinated on a yearly basis? And is that based on how much the virus varies?
Yeah, that is one of the $64,000 questions. Is this something that we're going to need to do again for the short term? Is this something that will ultimately just get mixed into an annual shot? Is this something that we're not going to have to do again? Dissatisfyingly, I cannot answer that question. We don't yet have enough information. How long does protection from the vaccine last is going to be an important part of that. How frequently does the virus mutate? And are we going to have to get something different because the vaccines no longer are effective? I wish I could tell you, but we don't have enough data.
Okay, I think we have enough time for maybe one more question if Dr. Lamb doesn't mind.
I don't mind at all.
So this question is really like dealing with COVID or vaccines. I'm sorry about that. I just want to ask you, for someone that's aspiring to or planning to study genetics in college, what advice would you have, if you have any?
Sure. And I'm sorry, I have forgotten your first name. Was it Nathan?
Alex.
Alex, sorry. Great, thank you, sorry. It's a great question. I think that the field of genetics is exploding, and there are so many different ways that it impacts our lives, whether you're talking about from a healthcare perspective or a way to sustainably feed the planet, or how do you create more energy, or how do you deal with infectious disease. So I think you want to look at a university that has a strong either genetics or sometimes it's called molecular biology program to give yourself a strong foundation that introduces you to the fundamentals of genetics. You also want to look for a place that's going to be able to connect you to internship opportunities, working in a lab on campus during the school year, working in a lab on campus or somewhere else, another university or another institute during the summer. And then you've got to think about, and this is way too early for you to think about right now, but you've got to think about, do I need to go on and get an advanced degree, a master's, a PhD, an MD, a master's in public health? So you want to look for a university that's going to give you a strong and solid foundation that keeps as many of those doors open and gives you opportunities to experience and step into as many of those different applications as possible. And if you are a computer whiz and you like coding, you have written your ticket, because informatics and data analysis is the wave of where genomics is going. If you're not a fan of coding, you might want to learn a little bit of coding on the side.
Okay, thank you so much, Dr. Lamb. That was fantastic. So definitely worth staying over just a couple of minutes. Thank you so much. Great information. I think half my head's cut off here. Okay, do we have anything else before we close with the four-way test? Again, thank you, Dr. Lamb. Okay, if not, please stand. Of the things we think, say, or do, first. Second, fair to all concerned. Third, will it build goodwill and better friendships. And fourth, will it be beneficial to all concerned. Thank you all. Have a great Thursday. Thank you so much.